Thank you for your interest in the Tiger study, an NIHR-funded study led by the University of Bristol. This video will cover the background to the study, its design, and what involvement means for your GP surgery. We are happy to follow this up by email with a meeting to answer any questions you have at the end of it. Before we start, we should remind ourselves of the importance of good clinical practice, or GCP. GCP is an international and scientific quality standard for the design, conduct, monitoring, analyses, and reporting of clinical trials. This trial is being conducted in accordance with GCP to ensure that research participants are not exposed to undue risk and that data generated from the research are valid and accurate. Eczema is common in children, and parents often ask their doctor whether a test might uncover a food allergy as a cause for the child's symptoms. If parents' concerns are not taken seriously, they may be reluctant to use prescribed creams, which they treat the symptoms and not the cause of the child's eczema. Specialists vary in their use of blood-specific IgE or skin prick tests, and there's a need for research to determine what role, if any, routine food allergy testing has in the management of childhood eczema. Tiger is a randomized controlled trial designed to answer the research question, does test-guided dietary advice improve disease control in children with eczema? We need the help of around 84 GP surgeries to recruit 493 children with eczema. For a typical list size of 10,000 patients, this means around 6 participants per practice. For your information, the complete list of eligibility criteria are listed on this slide. The electronic medical record search that we supply you with searches for patients in the right age range with a relevant diagnostic code or prescription. We will ask you to screen the electronic medical record search results to exclude anyone who is not suitable to be invited. We will provide working instructions for this process. To be clear, we do not expect you to review all eligibility criteria that are listed here, as these are checked by the research team when the parent responds to an invitation from your surgery to take part. Participants will be randomized to standard care or dietary advice based on the results of skin prick tests to the 4 study foods. The primary outcome is a patient-reported measure of eczema control called RECAP. A range of secondary outcomes include eczema symptoms, signs, and quality of life. Parents also have the option of letting us collect a saliva sample for DNA analysis for genes associated with eczema and food allergy. Everyone is followed up for 9 months. In addition to the trial, there are nested process and health economic evaluations looking at the implementation and cost effectiveness of this intervention respectively. Over this and the next 2 slides, I will talk you through participant recruitment and follow-up, and where your surgery fits in as indicated by the stethoscope symbol. First, you will run an electronic medical record search for potentially eligible children. We only ask that you undertake a light touch screening of the results. Full eligibility will be determined later by the research team if the parent submits an expression of interest. If it is not appropriate to send anyone an invitation or there are obvious reasons why they're not eligible, please give a reason why. The list of codes will be included with the instructions we send you on how to do the search, screening, and mail out invitation process. We appreciate that it can be difficult from just the medical records to determine, for example, whether a child currently has eczema, so if you are unsure, please be inclusive. You will then send an invitation letter, followed up by a text reminder to the parent or guardian of that child. This can be delegated to a colleague in your practice, and the written instructions that we send you will cover how to do this. We will ask you to repeat this in a few months' time to capture any new children with eczema. In addition, you can opportunistically signpost parents of potentially eligible children to self-refer into the study via the website. Interested parents will contact the research team, who will confirm full eligibility, receive consent, collect pre-baseline data, and arrange the baseline visit. The baseline appointment takes place at a GP surgery. This will either be at yours or a neighbouring participating GP surgery. We will also ask if you're willing to host the baseline visits for patients from other nearby GP surgeries. In addition to a clinical room for the baseline appointment, we will also need medical cover for the unlikely event of a reaction to the skin prick testing. Serious reactions are uncommon, of the order of 1 in 10,000, so similar to childhood vaccination. If the participant is randomised to the intervention group, they will have a skin prick test to cow's milk, hen's egg, wheat and soy, and will be given dietary advice according to the findings. For safety, some children will be referred by the research team to have an oral food challenge as a day case at their local allergy centre. All follow-up over 9 months is done by the Tiger research team, mostly by means of questionnaires with a face-to-face assessment, usually in the participant's home at 24 weeks. Care of participants is otherwise unchanged, including referrals to secondary care if appropriate. By default, baseline appointments will be delivered by a Tiger study research nurse. However, if your surgery has the capacity and interest, we will offer to train staff in some practices to deliver the intervention themselves. We have limited funding to train and pay staff to carry out the intervention, so if there is a lot of interest, we will not be able to train all interested sites. Any practice-based clinicians doing this will still be accompanied by a Tiger research nurse to undertake the research-specific activities. The risks to anyone taking part in this study are low. This slide gives the definition of the adverse events and reactions as listed in the protocol. Site teams are responsible for identifying adverse events for their participants during the trial, during trial-related appointments, and any other appointments or admissions, as reported by participants and/or healthcare colleagues. This slide is a reproduction of the flowchart in the protocol and what action needs to be taken according to what type of safety event has occurred. Please refer to it if needed, but if you're unsure about the significance of any event in a study participant and whether to report it or how to record it, contact us and we'll be able to advise you. Payment follows research activity as detailed on the research information sheet and this slide. In order to give your practice the green light and begin the search, screen and mail out task, please complete your contract and delegation log as soon as possible. The trial is paperless with all study paperwork, including the current version of the study protocol, accessible via the study website. Thank you for listening to this presentation. Please contact us by email with any questions or to arrange a follow-up meeting to get you started.